Hi, I'm Srikanth. I'm a specialist in neuromusculoskeletal therapy. Today we'll discuss about the role of physiotherapist in bankarts repair. First and foremost, what is this bankarts? Bankarts is nothing but stripping of anterior glenoid labrum. So the head of the humerus will be slipped forward. This leads to recurrent anterior dislocation of the head of the humerus from the glenoid cavity of the scapula. So this will be inconvenience for the patient whenever he is doing shoulder abduction and external rotation. There is chance for shoulder subluxation. So the orthopedic surgeons, what they will do, they will repair the bankarts lesion. So what is the role of physiotherapy here? So they have to, the client has to keep the arm in a shoulder sling with a 35 to 40 degrees of shoulder abduction. So sling is very important, and he has to do the ball squeezes, and he has to remove the arm sling, and we can encourage elbow flexion and extension, wrist flexion and extension with the ball squeezes. So always we have to keep it in our mind that we have to encourage active assisted range of motion, and passive range of motion is very important up to 6 weeks. So what is the thing is to minimize the substitutional patterns. We are going with a passive range of motion exercises up to 6 weeks. Then we can also encourage the active assisted range of motion. As a physiotherapist, our main intention should be controlling the pain, minimizing the pain and reducing the swelling, and minimizing the muscle inhibition. So, and minimizing the substitution pattern of movements. These things are very important, along with the the surgical healing of the soft tissues. Also, the therapist has to be keep it in mind. So, in after 6 weeks of post surgery, the therapist has to encourage the scapular retraction and external rotation in the scapular plane. It should be 25 degrees, and you can encourage shoulder flexion up to 90 degrees. The two active assisted range of motion, shoulder flexion and also shoulder abduction up to 90 degrees with a band. The client can perform the movement. And in the sideline position, we can also increase the internal and external rotation. And one more thing is this periscapular setting exercises, prone scapular retraction, and prone lying shoulder extension with the scapular retraction, and scapular serratus anterior punches, and we can also encourage the thraband exercises in the diagonal pattern away from the body and towards the body. So these diagonal patterns also helps in flexion, abduction, external rotation, extension, adduction, internal rotation. After 8 weeks of post surgery, the therapist has to concentrate on external rotation, 45 degrees of external rotation, and 20 degrees of internal rotation, along with the shoulder flexion to 125 degrees, and also abduction to 125 degrees. So scapular retraction exercises, and scapular prone scapular setting exercises, and standing scapular setting exercises is very important, and low rowing exercises, and T shape and Y shape of the limbs in a prone lying position is also very important for the better rehabilitation of the patient. Thank you very much.